Hello everyone. During today's lecture, we will briefly talk about the dengue fever. What is dengue fever? Dengue fever is an illness that is similar to a serious case of the flu. It is caused by a virus carried by the mosquitoes. Most people who have dengue fever recover in about a week. Sometimes the infection is more serious, and occasionally it could be fatal. You can catch dengue fever if you are bitten by an infected mosquito. Dengue is found in tropical and subtropical countries in Africa, Asia, and South America. Most areas of Australia do not have this type of mosquitoes that carry dengue. However, outbreaks of the disease still occur in North Queensland every year. When someone becomes infected overseas, now when they come to Australia and when they are bitten by a mosquito in Australia, that mosquito could spread this virus to other people. Now, what are the symptoms of dengue fever? Dengue is transmitted only by mosquitoes. It is not transmitted directly from person to person. Now, if you have dengue fever, you might have the following symptoms, such as fever, from mild to severe, headache, muscle and joint pain, pain behind the eyes, nausea and vomiting, swollen glands, rash, bleeding nose or gums, and fatigue. So people could feel really tired and exhausted. These symptoms may be mild or severe. They usually appear between 3 and 14 days after the mosquito bite, but usually last for between 2 and 7 days. There's no vaccine or any specific medicine to treat dengue. People who have dengue fever need to drink plenty of fluids, have enough rest, and try to use paracetamol to reduce the fever. If the symptom is too severe, now they should still see a doctor. So there's no effective treatment, but we can just take paracetamol to reduce the symptoms and have enough rest and drink enough water. Now, what are the symptoms of severe dengue fever? Severe dengue is a potentially fatal complication affecting mainly the children. Diagnosing it in the early stage could increase the survival rate. Some people can get severe dengue fever if they have had dengue fever in the past. When people have severe dengue fever, they could feel really unwell and have extra symptoms such as nose bleeding, stomach pain, difficulty with breathing, persistent vomiting or even blood in the stool, restlessness, confusion, heavy bleeding in the nose or gums, and cold and clammy skin. This is a serious illness and it can be fatal. So if you do have these kind of symptoms and you think you may have serious dengue fever, now you need to go to the hospital emergency immediately. How is dengue fever diagnosed? Normally, doctor will take a blood test to diagnose this virus. Now, the blood test can show whether the virus is present or not. How is dengue fever treated? There is no specific treatment for dengue fever, but you can always ease the symptoms by taking enough rest, drinking enough water, and taking the paracetamol to reduce the fever. If you have dengue fever, please remember, do not take non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen because these medications could cause the risk of bleeding. So how can we prevent dengue fever? Because there is no vaccine to prevent this fever, the best way to prevent this is to avoid being bitten by mosquitoes. So if someone in your house has dengue, It is especially important to avoid mosquito bites because mosquito can carry the infection from one person to another. So it is important that you stay inside during mornings and evenings when mosquitoes are active. Use air conditioning and window screens. Use mosquito nets in the bedroom. You can wear long-sleeved clothes and covered shoes. Use a mosquito repellent or regularly check and drain any still water around your home. Always use clean water. Do not contaminate the water. Mosquitoes breed in still water, such as the water in empty containers. Yeah, so make sure you always use clean water. Yeah. So hopefully this little lecture could help you understand a bit more information about dengue fever. Thank you, everyone.